Could the Office of Supporting Housing please move to the witness table? Office of Supporting Housing, are you here?
Oh my gosh, we're going to have to do a second hearing on that.
I know. I thought, did you submit one? Did you submit a resolution for hearings on the bills?
I would have to check that out.
Okay, because I remember seeing something on it.
I know
Green did it, Councilwoman Tasker did it before she
Yeah.
left, Councilman Jones had a separate hearing.
I really want to stay for this one. My husband's like
I
that.
think we need to get going.
I'm like,
Seek to balance this out. They will understand. I'm having to give their testimony. We're out of here.
Okay. You're welcome.
I feel like they should buy you dinner.
Good afternoon, Office of Supportive Housing. Can you please join us at the witness table?
Hey, Mr. President. Oh my.
Jesus got popped up. I think they're going to start looking at babies.
Good afternoon.
Good afternoon.
Evening.
No, we're still afternoon.
So if you could state your name for the record, and then please proceed with your testimony.
Thank you. Good afternoon, Council President Clark and members of City Council, or member of City Council. My name is Liz Hersh. I'm the Director of the Office of Supportive Housing. Joining me today are Joy Presson, Chief of Staff, and Rodney Cherry, Fiscal Officer for OSH. I'm pleased to provide testimony on the OSH Fiscal Year 2017 Operating Budget. And I want to note that today is my 2-month anniversary in this job.
Well, welcome aboard. You are 60 days old.
Old being the operative word there.
And let me just say for the record, because you do not see council members here, present, visually, we do listen in our offices. Okay?
Great. And I noticed that Councilwoman Bass had read my testimony, so I was quite pleased to see that. The mission of the office of, I wanted to say that the OSH staff and clients and providers are deeply appreciative of the precious public funds that are made available to us and trusted to us to carry out this important work. We don't take this for granted. Thank you very much. The mission of the Office of Supportive Housing is to provide the leadership, coordination, planning, and mobilization of resources to make homelessness rare, brief, and non-recurring. The homeless system is comprised of 63 mostly not-for-profit providers, city, state, and federal entities that together provide emergency housing and services to people who are both literally homeless and at imminent risk of being homeless. In addition, OSH provides emergency response and service days, which are cleanup of encampments, manages food and commodity distribution to contracted shelters and soup kitchens, and offers services to people when license inspections issues cease operations. And we also run a personal care home called Riverview, which is up near Greater Ford Prison. OSH's budget request for FY17 is $93,509,923. This represents an increase of $335,289 to cover 3 new positions for our Homeless Management Information Service and the 2.5% raise for both DC-47 and non-represented employees. OSH has some notable successes to report for FY16. We reached functional zero on veterans' homelessness, an accomplishment we are now working to sustain. No families were found living on the street. I don't think that should be an accomplishment, but it is an accomplishment in this day and age. We helped 458 households prevent shelter admission. Our rapid rehousing program has housed 209 families with an 85% success rate in preventing a return to homelessness. And yesterday, thanks to the very fine work of our staff and our provider network, we got our second award from HUD to fund new and renewal units, bringing total grant funding to $35,363,966. This new grant adds 55, and that is, by the way, the biggest grant the City of Philadelphia has ever gotten from HUD for the continuum of care, and it was the 3rd largest award in the nation. So really proud of that accomplishment, and these are competitive dollars. The new grant adds 55 units of rapid rehousing for families and 60 of permanent supportive housing for chronically homeless individuals. And I'm very pleased that on the heels of all of the discussion about youth homelessness, that we will be able to dedicate some of those units of rapid rehousing for families that are headed by young people between the ages of 18 and 24. So that's an immediate new resource to address this problem. We also this year got a TANF for rapid rehousing pilot for 50 West Philadelphia families, homeless families. This is the first such program in the state. We've already filled the 25 slots for this year, and this is expected to be a model program for Pennsylvania. We're one of 22 cities to be part of the National Voices of Youth count being conducted by Chapin Hall to try and assess how many young people actually are experiencing homelessness. And we're part of a first ever grant from the William Penn Foundation, thanks to a collaboration by People's Emergency Center and Bright Spaces, and that'll be to improve the experience of children who are homeless while they're in our intake centers and some of our shelters. So they will have a little better time of it. So thanks to People's Emergency Center for that. The numbers of people seeking help from the Office of Supportive Housing are dramatic. Our intake sites have seen this fiscal year, over 8,000 single men, 6,200 single women, and 3,276 families. And in 2015, 60 people died while homeless. And I think it's important to remember the stakes of this work and that people die on the streets. And we really want to do better. We need to do better for those people. In 2016, 6,112 Philadelphians were identified as experiencing homelessness. And this is a very specific number. It's dictated by the federal government in how we count homelessness, and it's done through a point-in-time count, basically a snapshot, conducted on January 27th, 2016. This year, we identified that 705 single adults were unsheltered. Again, no families were unsheltered. That doesn't mean that no families were homeless. It just means that there were none on the street. Of all of the homeless families and individuals we counted, 885 families and 2,154 singles were living in either emergency or transitional housing. So that means that even though those folks were sheltered, and so they were safe from the elements, they were not in a home of their own. They were being cared for in either emergency or transitional housing or a safe haven. Of the people experiencing homelessness, both sheltered and unsheltered, again, at this point in time, 13% were between the ages of 18 and 24, 41% were severely mentally ill, 43% had chronic substance abuse. And I want to note that for those people who are unsheltered, the percentages of people experiencing severe mental illness and or substance abuse disorders are higher. And 11% reported having been victims of domestic violence. So those are the numbers of people that we are serving. The homeless system, and also not serving the 700 on the street who are probably touched by outreach. The homeless system has a total of 11,545 total beds. 11,545 beds. 3,768 of those are emergency beds, of which 42% are for families and 58% are for singles. This is important to note because when we get to permanent housing, you'll notice that the numbers are flip-flopped and more permanent housing is available for families and less for singles. And that's really by design to try and move families through the emergency housing system and into permanent solutions. There are 1,905 transitional beds, and those provide up to 24 months of rental assistance with services, and 72% of those are for families, 28% for singles. So you see a high proportion of singles in the emergency housing system proportionally, and more of the families served by permanent and transitional housing. And this has been a strategy over time. Of the 646 permanent beds, 57% are for families, 43% for singles. And thanks to our partners, the provider network, the Public Housing Authority, the Department of Behavioral Health, we have 1,110 more permanent housing units under development. So our plans for fiscal year 2017. Focus on homelessness prevention, shorter shelter stays, and permanent housing, especially for families with children. We know that children who experience homelessness are more likely to have mental health and substance addiction disorders, a lifetime of dependency, and poverty. And we are committed to finding ways to preventing homelessness among families, shortening their stay in the shelters, which now averages at about 5 months, and helping them get into either rapid rehousing, transitional, or permanent housing sooner, especially if we can before August when children start school, so you don't have that destabilization of children moving throughout the school year. We want to target youth homelessness. We're so pleased that City Council and the advocates have shown the spotlight on youth homelessness. It's a very disturbing trend. We're particularly concerned, we're concerned about all the young people on the street, but the high incidence of LGBTQ kids and the incidence of opiate addiction, these are very disturbing trends and ones that I think take special attention. And we're very pleased to look forward to working with City Council, with our provider network, with the school district, with DHS, with anybody who's willing to come to the table to try and do a better job to expand services and have an impact on youth homelessness. We want to approach street homelessness and chronic homelessness with reduced energy. And I differentiate because street homelessness includes both people who are chronically homeless and those who may be on the streets who are not chronically homeless. But if we don't do something soon, they will be. It takes significant outreach and engagement for people who are on the streets to come inside, and we have to have the right mix of opportunities for them at the front door, and we have to have a way for them to go out the back door. And that's really the tricky part and also a resource question. But we're doing what we can, and so here's just a couple of the things that we've already started doing. We've already identified and deployed almost 100 new units just in the last 60 days, so that we can do a better job of helping people get off the street. And I want to especially acknowledge the Housing Authority for their partnership in making this possible. We could not do it without them, and the Department of Behavioral Health and their cooperation and their support. We are redeploying the street outreach teams to be zone-based. Up to now, they've largely been on demand, so if you call, they go out. And in addition to that now, we've added new teams, or DBH has been funding that, and they will have zones, particularly in the downtown area. The rest will continue to be on demand around the Convention Center, South Broad, Rittenhouse Square, and Market East. So we'll be seeing them in May, starting with their bright orange shirts, being ambassadors to the business community, and really do kind of a man-on-man defense to address these areas where there's high concentrations of people living on the streets. And we're also launching a 100-day action plan to address street homelessness. This is how we started the successful effort to end veterans' homelessness. It's getting all the stakeholders together and setting audacious but attainable goals to address what we can do in 100 days to address street homelessness. And it'll also focus street homelessness, youth homelessness, some of which is street and some isn't, and non-chronic street homelessness. And this is already scheduled for June 20th and 21st at the College of Physicians. So we're really excited to be able to jumpstart these initiatives with some bold action steps. In addition to these programmatic goals, we have a few what I would consider to be infrastructure goals. First is the implementation of the Homeless Management Information System. We want our system to be data-driven, but we don't have a good data system. So that really is job one. It's well underway. We're working with a new vendor who just started this fall, and we believe that we've already started to enter data in real time, and we hope to plan to have this system live in May or June. We are adopting a coordinated entry system. Right now, where you line up largely determines where you end up and which services you have access to. And coordinated entry is not only the state of the art, but it'll provide streamlined participant access to services with a standardized assessment of needs to link them to the most appropriate resources available to address their housing crisis wherever they line up. So we're very excited. This is major systems transformation. It's going to take several more months to get through the design and plan phase. Then it will be implemented first on a pilot and then whole scale. But it really will make, we believe, a dramatic difference in access to the appropriate services and standardized assessment for everyone who enters our system. And it's time to do a big plan. Our last plan was a 10-year plan. We haven't decided if 10 years is the magic number yet, but it ended in 2015. And this is our opportunity to step back, to take in all the new evidence and research and data and thinking around how to make homelessness rare, brief, and non-recurring based on what people in this need and around what's available in our system, and to look at the deployment of resources and to ask whether we're doing everything we possibly can and what we want to do differently. And this plan will be data-informed, evidence-based, and outcomes-driven, with a plan that's achievable, clear, and concise, and we will monitor our performance based on achieving the goals that we set in this plan. And we'll do this with the input of our Continuum of Care Board. And thanks to the excellent work of the OH staff, some of whom are still here now, and our provider community and HUD, we do have funding to support the 100-day plan, the coordinated entry, and the HMIS system, as well as the new strategic plan. And I want you to know, as the keepers of those precious city public dollars, that we are leveraging federal dollars and state dollars and not just relying on the city to support these programs. And finally, we are moving towards performance-based contracts. We're aligning our work with the Mayor's Office of Performance Management. We're very concerned that the outcomes that our system produces are appropriate and that they're realistic, and that they, more than that, that they capture all of the rich services that are provided and delivered through our service network, which right now I think we're really not capturing the richness of our service network. So we're very excited to have the data, the plan, and to have the metrics and start to build that in so that when we come back to you over time, it's not just reporting on beds, and we do need to report on beds. It's very important that people not be out and exposed to the elements, but we also want to report on the quality of our programs and what difference we are making in the lives of the most vulnerable Philadelphians and in our progress towards our mission of making homelessness rare, brief, and non-recurring. Thank you so much.
You are welcome. The work that you do is priceless. You simply can't put a price tag on it. Trying to
Thank you.
save families. Councilwoman Bass?
Yes. Good evening.
Good evening.
I just have the one question that I asked someone else, which was about the safety and security at the shelter.
Yes.
And again, tragically, there was someone who was killed.
His name is John Barksdale. I think we
Mr.
should
John
remember his name.
Absolutely, absolutely. And unfortunately, losing Mr. Barksdale, but we did put some safety measures into place as a result. And from your testimony, I really couldn't get a grasp of what was in place before and what is in place now. So I don't know if you could go over that.
Yeah, I'm going to turn it over to Joy Presson, who has been here for a little bit longer to talk about what's been in place before, and then I can tell you a little bit about what we're trying to do.
Please state your name for the record.
Joy Presson.
And please pull the mic closer to you.
Joy Presson. Well, prior to the incident that occurred at the South Station House with Mr. Barksdale, the security measures were primarily at the purview of the individual shelter providers. And so at the time that the incident occurred with Mr. Barksdale, the provider did have security measures in place. They had security guards. They had a locked front door. The security guards the security guards did check everyone as they were coming into the front door. In this particular instance, the perpetrator came in the door with the food service workers.
Right.
So he was not stopped.
Yes.
And he kind of came in shooting. So since that unfortunate incident, what we have done is collected all of the security protocols from all of the providers that we fund. And we have been looking at them in an effort to standardize the procedures across the system. So that, coupled with what the administration put in place with the safety and security and risk assessments, when we get the reports from all of those assessments of the sites that have been assessed, we will look at all of that information and standardize all of our procedures, particularly and line them up with particularly the recommendations from LNI, the fire marshal, and or the police department.
So was there any assessment requirement previously to a provider?
Safety assessment?
Yes.
Not formally, I mean, other than on an annual basis, our inspectors would go to the various shelter facilities and conduct an inspection, but it wasn't necessarily geared towards safety.
Okay, so there would be an inspector who would come out and who would check sort of cleanliness and conditions.
Conditions
and-
of the facility.
Of the facility and those sorts of things. But there wasn't any overall assessment of maybe, bringing in a security professional or the police to say where the holes were or anything
No,
like that?
unfortunately, we had not done that.
Okay, all right. But that is being done now.
Yes.
And now there are standards across the board for all shelters throughout the city?
We're in the process of
process.
standardizing those procedures, and a lot of it will be based on what L&I tells us or what the police have said as they've gone to various different sites and conducted a review.
Okay. And when will that process be complete?
We don't have the reports of all of the assessments yet. We're waiting for them to complete their assessments of, I think we gave them 13 priority sites to assess. So as soon as we get that report, I would say over the next 3 months, 3 to 6 months.
3 to 6 months. We should have standardized safety procedures in place.
Yes.
Okay, great. Thank you very much. That's it. Thank you, Madam Chair.
Oh, you're welcome.
The sites do all have security, and they do all have metal detecting wands in place.
Okay, then. Councilman Heenan, might you have any questions at all, sir? Okay. All right, then. Well, is there anyone else to have questions, comments, observations, suggestions, recommendations for the House OESS? Very well. Let me close with this team of professionals as I did with DHS. The work you do is incredibly important. Your compensation in nowhere matches probably, members of council work 9 days a week, 72 hours a day is what I say. I would suspect that your work comes close to that. So thank you all on behalf of the work you do every day on behalf of the citizens of our city. With that said, this committee will stand in recess until Wednesday, May 4th, 2016 at 10 a.m., at which time we will reconvene in room 400 City Hall. Thank you very much.
Thank you.